Hi, everyone, and welcome to the New Jersey Fire and EMS Lifeline webinar. We're really excited about today's program, so we're going to get started. My name is Ravi Maharaj, and I'll be kicking off our program just with a few key points for today. First and foremost, I'd like to welcome each of you for joining us. If you're not familiar with our program, it is geared towards supporting New Jersey Fire and EMS personnel. We are a peer-to-peer support lifeline, meaning when you dial 888-653-3367, the person on the other end has life experience working as a firefighter or an EMT. So they understand. They've been in your shoes, responding to an emergency at 2 in the morning, covering shifts on weekends or after a full day of work, answering backup calls. Regardless of what the emergency is, a firefighter and an EMT always respond. So we understand and we're here for you. Today's webinar is going to be really great. We're really excited about our speakers. So I'd like to just get started. I'd like to introduce Cherie Castellano. She is our director of the National Peer Call Center. And she is just has a wealth of information to share. So I'm going to hand off. All right. I'll see you all at the end of the program.
Hi, my name is Cherie Castellano, and I'm so excited to talk to you today about the New Jersey Fire and EMS Peer Support Lifeline program. What we understand is that New Jersey firefighters and EMS professionals need each other. They understand each other. In peer support, we share our lived experience. So the purpose of this program is to create a way to help you deal with the stressful work that you're doing, saving lives every day. At our National Center for Peer Support at Rutgers University Behavioral Health Care, we have 20 years of experience working with first responders. We only focus on high-risk populations like fire and EMS professionals who need access to a peer. We're culturally and strength-based. We have clinical partners to ensure safety. And after 20 years of peer support, we have over 250 peer counselors available at our center, and we are a national best practice in peer support. Now we know with our Fire and EMS Lifeline, we have to offer peer support as peer prevention, intervention, and postvention. It all began 20 years ago with the Cop to Cop program that remains the only legislated peer program in the country for police officers. What we understood after 100,000 calls was that you need to focus on not just being a suicide line, but allowing people to get ahead of their emergencies and their crisis and allow them to vent with peer support. At Rutgers, we have a first responder unit at our national center. So those programs include Cop to Cop, a resilience program officer line, a corrections line called 4 Blue NJ, a national pilot for Cop to Cop, our New Jersey Vet to Vet, and now it includes you, the New Jersey Fire and EMS Peer Support Program. The mission of our program is to use peers who are retired and active firefighters and EMS professionals who understand the challenges you face every day. The services include peer support over the phone. When you dial 1-888-NJ-FD-EMS, you get a live peer counselor to help you with your issues. We also have a telephonic ability to assess you when you call that number. And we have a network of providers that specialize in working with first responders. We do resilience webinars. We have a QPR for firefighter and EMS professionals course, which teaches you how to be your brother and sister's keeper. And we do resiliency work for first responders. In addition, we have a critical incident stress management team to help after difficult challenges in your work. And we're providing mutual aid for firefighters and EMS across the state, in addition to the FMBA CISM team. Where we began was this July in 2021. We want to thank Ed Donnelly for his support from the FMBA, but the idea was to really resurface a project that was created after 9/11, where we would use fire and EMS peers along with clinical staff and model the program after our other nationally renowned programs like Cop to Cop to create the ability to improve the quality of your life, support you, do, like I mentioned, webinars, firefighter courses, create crisis response, and recognize that you need a specialized provider. We actually need more peers. So if any of you are interested in a job, I'll talk about that in a minute. But so far, we've had over 390 contacts. That's both incoming calls and outgoing calls, as well as contacts in crisis debriefings. So what we offer is things like prevention. We have a QPR for New Jersey firefighter and EMS professionals. QPR is like CPR. It teaches you how to be a gatekeeper, how to question, persuade, and refer to help your brother and sister first responders. We have resilience webinars like this one today. We'll have them every month, and we'll focus on an evidence-based model to build your strength. And then we even have a Rise Road to Resilience event, which is something we can come out to your firefighter teams or EMS units to provide an in-person event that's related to overcoming COVID, thanks to our other programs at Rutgers and funded through the state. QPR for firefighters, just to tell you quickly, was based on a need to recognize that you can intervene, question, persuade, and refer someone to help to stop first responder suicide. In a survey with the IAFF, what we know is that 19% of those who answered the survey had thoughts of suicide. 27% struggled with substance abuse. 65% were haunted by the memories of traumatic situations. And 81% believe that asking for help will make them seem weak or unfit. What we know is that this is why we do peer support, because it's a safe, confidential way to get help. And there's no stigma attached to talking to someone who has literally walked in your shoes. We have this QPR course available to come out to you where we can teach you to question, persuade, and refer. The next thing we have is the webinar series. We start with today's series around self-awareness and emotional intelligence, but throughout the months ahead, we'll be asking you to join us to build your resilience. The resilience work is based on the 6 skills that our other speakers will talk about today, but this is an evidence-based model out of UPenn. In our road to resilience, this is where we have you engage in our COVID activities that are about overcoming the impact of COVID on first responders in an event that we can bring out to the community called Road to Resilience. In terms of our peer counseling services, all you have to do is dial the number. We answer the phone, we ask questions, we gather information. It's all confidential. You'll speak to a peer who's supervised by a clinician. And then at the end of that first call, we'll ask you, can we assign a peer counselor to you? If you say yes, that firefighter or EMS peer counselor will call you every week, every day, every month, whatever is needed to help improve the quality of your life. We have a special first responder network that are providers who understand the unique needs of first responders. And we even have some specialty services that are unique to your exposure to trauma and COVID. The model that we use is called reciprocal peer support. And these are the 4 tasks. But I think what's important to know here is that our peer counselors on the fire and EMS line are trained professionals who are supervised and paid to do this work to help you improve the quality of your life. In postvention, we understand that there are traumatic incidents, critical incident stress management is needed after you're exposed to vicarious trauma. So although there are teams out there in the community through the state, through the FMBA, we have our own team at the New Jersey Fire and EMS program where we can come out within 48 to 72 hours and provide an in-person or a virtual debriefing, as well as offer a variety of psychological first aid services so that we can mitigate long-term post-traumatic stress disorder and help you get back to the job and to your family after a critical incident. We understand that marketing and explaining the program is important. So here's some of the media that we've created to help get the line and the information out about the stress that you're all exposed to. And like I mentioned before, we are looking for new and experienced peers. So you can be active or retired or a volunteer, and you can be an ambassador and just work with us as a volunteer, or you can join us as a paid peer counselor to give back, since we know that doing that is a reciprocal experience. We have websites, we have social media, Facebook, Instagram, Twitter, so you can stay connected and communicate with us with whatever you need. We do have some forms and information so that during this webinar, you'll be able to let us know if we can stay connected to you after it's over. And I think you can put our number in your phones as you're watching this webinar, 888-653-3367. So it's just a quick hit to reach out. We've been where you are. Thank you.
Hi, my name is Marie Vogel, and I'm a clinician with the New Jersey Fire EMS Lifeline. I've worked with first responders in past few years, but really understanding what emotional intelligence is before we get into why it's important for you and your department and your agency. So emotional intelligence really refers to the ability to identify and manage your own emotions, as well as the emotions of others. This term was coined by Daniel Goleman in 1995. However, it was really to look at emotional awareness and the ability to perceive, identify, and name your own emotions, really taking into effect that self-awareness, which we'll get into later with Michelle Julian. But emotional intelligence is an important key in firefighters. And why might firefighters, dispatchers, EMS professionals need emotional intelligence? Really, because the high risk environment, what you see in day in and day out is not normal to the average human, right? And so you need to really be aware of what's going on in you and your own emotions and how you're perceiving things, as well as the increased demands create high stressful environments. These past 2 years with the COVID pandemic, as well as low staffing, all these challenges have increased the demand that's placed on you as a first responder. The U.S. Fire Administration reported that heart attacks are the leading cause of death among active duty firefighters. And it went further into talking about how it's because of this high risk, high stressful environment, the ability to at any moment have to go into a crisis situation and how to handle that. And that chronic crisis stress on a person can take a toll on you. So according to research study presented at a conference, emotional intelligence can play a role in reducing that death and injury for firefighters. So really taking a key into what's going on with you and your emotions is going to help increase and improve your overall medical as well as your body's functioning. And research shows that emotional intelligence also improves effectiveness, efficiency, and commitment. So not only is it going to help you medically, it'll also improve you the job that you're set out to do. Emotional self-control, empathy, compassion, and mindfulness in an organizational leader can go a long way in valuing skills, abilities, and dedication to firefighters. So let's look at a video now that really ties into self-awareness and emotional intelligence.
A lot of people are not aware themselves of how they come across to other people. Other people see it, but they don't see it themselves. It's really important to become self-aware. And self-aware means the tone of voice that you're using and how people are responding to that. The way you're communicating. Are people really clear? Are they understanding? Are you building teamwork? What is happening? And sometimes you're in reaction. A lot of times we don't even know when we're having an emotional reaction. Somebody says something, you take it wrong, you take it personally, now all of a sudden you feel under attack. And then what you say and do from that point of view, are you really aware that you're having a reaction and you're lashing back or not? A lot of people just do it. They have the reaction, but they don't say, oh, I'm having a reaction, I need to calm down or whatever. And the best thing that you can do is to be able to focus on what's the outcome I'd like to get. What's the outcome that I want? And then what do I need to do to bring about that outcome? If you do that, you can override the reactions you have, because most of the time when you have a reaction, it results in some form of self-sabotage. Self-aware people this is the beginning of emotional intelligence. It's interesting, I took an emotional intelligence test a while back. And when I first saw that they were offering it at this website, I thought, this is kind of crazy. How can you give somebody an emotional intelligence test? Because think about it. Emotional intelligence is about how you behave when you're emotionally stressed and emotions are washing over you. You take a test, it asks you questions. So I took the test. It says, okay, here's a scenario. This is going on and this is going on. What would you do? Well, I teach this stuff, so I know what you're supposed to do. That doesn't necessarily mean that's what I do, especially if I'm emotionally upset. But I answered all the questions, and I got 100%. Now, my wife will tell you I am not 100% emotionally intelligent, especially when things happen and stuff. I react, we all react. And the whole thing about self-awareness is, do you know when you're reacting? That's the start. You can't change it unless you're aware of it. So many times I see how she pushes my buttons, and then when my buttons are pushed, I see what I do. And, you know, I was talking about the definition of insanity. I had a preacher told me one time, he said, if you always do what you always did, you'll always get what you always got. It's another way of saying repeating the same behavior, expecting a different result is a definition of insanity. So I had certain behaviors. My marriage didn't work out, got a divorce. I ended up marrying a woman with the same profile. Do I have the same tendencies to do the same thing? Yes. But I also know if I do the same things, I'll probably end up in the same place. Right? So then I catch myself all the time. Now, a lot of people get defensive if somebody tries to help them with their self-awareness. And I can say defensiveness is probably the biggest thing that if I could say that is your enemy, it's your own defenses. Because people are trying to help you. Maybe they're not doing it in the right way, the way you would like it, at the time that you would like it. But any feedback you can get from somebody that helps you become self-aware is really helpful. If you get defensive, people stop telling you stuff. You don't want to be in that kind of situation.
Well, thank you. Now I'm going to turn it over to Michelle Julian, who's going to go into resilience. But some key pieces are really making a change, right? Being self-aware and really understanding that, you know, making small changes can really impact and have a better result if there's a different outcome that you want to have, as well as being self-aware. So turn it over to you, Michelle.
Thanks, Marie. I love what the video stated about the first step of emotional intelligence really is that self-awareness, and that's why we're all here today, right? But before we get into self-awareness, we really want to understand the foundation of resilience. First and foremost, just by you all signing on today, you're already proving your resilience. But let's dive into what exactly is resilience. Resilience is the ability to grow and thrive in the face of challenges and bounce back from adversity. So here on the slide, you can see the 4 pillars of resilience. We have mental, physical, social, and spiritual. These are our foundation when practicing resilience. Resilience isn't just about bouncing back from adversity in those really stressful times. But when we make resilience a habit every single day, it allows us to provide balance to our life. Next. So the UPenn Positive Psychology Center did a study on all the skill sets within an individual, and they found that these 6 specific skill sets directly correlate to how resilient an individual is. So those 6 resiliency skill sets are self-awareness, self-regulation, mental agility, strengths of character, connection, and optimism. So since we're talking about this topic of emotional intelligence, we're really going to focus on self-awareness as our very first step. And according to UPenn Positive Psychology Center, self-awareness is the ability to pay attention to your thoughts, to your emotions, to your behaviors, and your physiological reactions. Next. So what does self-awareness look like for fire EMS, right? It's all about recognizing your emotions, understanding those emotions, labeling those emotions, expressing those emotions, and what we'll talk about next month is about how we regulate those emotions. But self-awareness is really the first step. It's that key to regulating one's mental health. So today we're just going to be focusing on what self-awareness looks like to us and how we can build it into a daily habit. Next. Self-awareness and our 2022 intentions. I know it's almost the end of February, but we are still in this new year. And in this new year, a lot of us tend to look towards New Year's resolutions or new intentions, right? And maybe one of your intentions was to work on becoming more emotionally intelligent. So one way we can use self-awareness to align our intentions is by turning to our core values. And again, since our topic here is emotional intelligence and it is self-awareness, we really have to know our core values before we can allow those values to become our compass in our day-to-day. So what we're going to go through we're going to go through these questions here right now. What I invite you to do is, if you have a pen and a piece of paper, to write these down, and you can write down your reflections as we go, or I invite you to schedule at least 5 minutes later on throughout your day in a quiet space to really gift yourself this opportunity to practice self-awareness and to reflect on these questions. So question number 1, what is important to you? You can name your top 3, or you can just allow yourself to list as many things that come to mind as possible. Question number 2, what makes you feel inspired and motivated? Now, with this question, I want you to get as specific as possible. Really think about the last time you felt excited. Think about the last time you felt motivated and inspired. Who were you with? What were you doing? What was your environment like? Really focus in and reflect on the specifics. The next question, who do you admire most? Now, when you find the answer to that, I want you to take it a step further and ask yourself what it is about that person that you admire. Asking ourselves these questions are really the first step of knowing our core values, which is the first step of self-awareness. So once we know our core values, we can then allow our values to become our compass. Next. So as we were doing that activity, if you felt like you were struggling a little bit to really hone in on some of your core values, I invite you to take a look back at the UPenn resiliency skill sets and try to create an intention or try to find a value for each skill set. Get as specific as possible, and I always think there's a magic to putting pen to paper, so do your best and try to write them down. Next. So once we become self-aware, once we practice self-reflection, our next step is to turn it into action. How do we get self-awareness to turn into action? How do we live into our intentions? The first question here is to become aware of any barriers that keep you from living out these intentions. So think to yourself, is there anything that's getting in your way right now? It could be something that's in your control. It could be something that's out of control. This practice here is just to give ourselves that awareness of those barriers that we may be facing when trying to live out our intentions or when trying to live out our values. So this leads to our next question, which is how can you set yourself up for success? Once we recognize and once we become aware of our barriers, we realize that there are some things that we can do to make sure that we can set ourselves up for success. We want to make it as easy as possible for ourselves to live out our intentions. And one way we can do this is by shifting our focus to the things that we can control, which then leads us to our next step, which is allowing our intentions and our identity to align. Now, this concept comes from James Clear's book, Atomic Habits. He really dives into the science behind building positive habits and getting rid of the habits that don't necessarily serve us well anymore. So in his book, we learn that intentions are really just those small habits that we do each and every day. So the question we have to ask ourselves is, do these habits align with our identity? So I'm going to let the master do the talking for the next couple of minutes, and we're now going to watch a video of James Clear on how our habits form our identity.
And even more so, your identity and sense of self a lot of times is all rolled up into your habits, which is even a crazier kind of a messing with your brain, in that these little things you do that you might ignore all the time could change who you actually are.
So I had this question while I was researching the book. I think identity plays a crucial role, but my question was like, well, how do we come to believe things about ourselves? Because when you come into the world as a baby, you don't have any preset beliefs or notions. That's not to say that, again, your genes don't matter. They certainly matter in some sense, like your height might be more or less baked into your DNA. But we all realize that if you grew up in a different culture or a different religion or a different community or household, you could adopt completely different beliefs if that was what you were raised in. And so I was like, well, how does that happen, right? How does this internal story that we tell ourselves, our identity, become shaped and formed? And I realized that it's mostly through the repetition of that story. And so what you come to realize is that your habits reinforce a particular identity. And Sometimes this can be positive and sometimes it can be negative. The story could be things like, I'm bad at math, or I'm terrible at remembering people's names, or I'm not good at remembering directions places.
Yeah.
And all of those that's just an internal story that you tell yourself, but each time you have an experience that reinforces that, the story gets solidified. And so I think the method, the takeaway here is that every action you take is kind of like a vote for the type of person you want to become. And if you can master the right actions, if you can master the right habits, then you can start to cast votes for this new identity, this desired person that you want to be. And I think that's one of the reasons why small habits matter so much. They don't necessarily transform your life overnight, right away. Like doing one push-up does not transform your body, but it does cast a vote for being the type of person who doesn't miss workouts. Or meditating for 1 minute might not give you an immediate sense of calm in your life, but it does cast a vote for being a meditator. And this is why one of the things I say in the book, like the real goal is not to run a marathon. The goal is to become a runner. The goal is not to write a book. The goal is to become a writer. Because once you've adopted that identity, you're really not even pursuing behavior change anymore. You're just kind of acting in alignment with the type of person you already see yourself to be. It's kind of like true behavior change is really identity change, because once you've changed that internal story, it's way easier to show up each day. You're not even really motivating yourself that much to do it. You're just like, this is who I am now.
I think there are so many important points in that video, right? But the one that sticks out to me the most is that true behavior change is really identity change, right? So let's take a moment and think right now, what identity do we need to take on to make self-awareness and emotional intelligence a daily practice, right? Maybe we need to tell ourselves that, I am someone who practices self-awareness. I am someone who is emotionally intelligent. And once we have that identity, we can then take the next step, which is habit stacking. And habit stacking is a concept, again, that comes from James Clear in his book, Atomic Habits. And it's really the key to making self-awareness a daily practice. What habit stacking is, it builds new habits by taking advantage of those old ones. So the formula used for habit stacking is before or after my current habit, I will then implement my new habit. So for example, after I brush my teeth at night, I will then journal for 5 minutes. Next. So we're going to habit stack right here, right now together. So again, take out that pen and paper. If not, please just use this time to reflect right here, right now with me. So there are 5 real steps to habit stacking. And the first step is listing your current habits, right? We can't build on our old habits, our current habits, if we don't know what they are. So we're going to practice some self-awareness right now. We're going to make a list of at least 5 to 10 habits that you are currently doing in your daily practices. This could be brushing your teeth, making your bed in the morning. It could be drinking coffee. It could be your morning gratitude. It could be prayer. It could be, saying goodbye to your family in the morning, whatever it is. There are little things that we do each and every day that we don't even recognize that we do, that are habits for us. So take this time and list out 5 to 10 habits that you do each and every day. Again, this is going to be our foundation to building new habits. So then step 2 is brainstorming these new daily goals, these new habits that we want to implement each and every day. So I invite you now to think of your top 3. What are 3 habits that you've been meaning to? What are 3 intentions that you've been trying to implement that just haven't been working out for you? What are 3 things that you want to implement? It could be related to self-awareness. It could be related to practicing your emotional intelligence. But just pick 3 new habits that you aren't currently doing and list those. Which then leads to our next step, step 3, which is foolproof your new habits. I believe this is the most important step out of all 5, right? We want to make sure that these habits are really small and attainable. We want to set ourselves up for success. If you're thinking that your goal is too small, then you're in the right place. We want to make it as easy for ourselves to succeed in doing this habit, right? So for example, if your new habit is taking 5 minutes at the end of your day to reflect on your day and on your emotions, right? Maybe instead of 5 minutes, you make it 60 seconds. So after you brush your teeth at night, you will reflect for 60 seconds on your day, the good, the bad, all of it. This is a small and attainable goal. We want to make it as easy for ourselves as possible. Step 4 is then adding that new habit to that old one, right? So we're going to refer back to list 1 and 2, and we're going to pick a new habit from list 2, and we're going to match it with a habit in list 1. So like I had just mentioned, at the end of your day, when you're brushing your teeth, you're going to pair the new habit of reflecting for 60 seconds on your day to the habit of brushing your teeth. And then lastly, step 5 is staying positive and consistent. This is also so important. Change does not happen overnight. I always say small steps lead to big change. And right here, right now, we are taking those small steps together into getting closer to experiencing that bigger change. We're here to celebrate progress and not perfection. So we really want to try to stay as positive and consistent as possible throughout this process. So I invite you to just take one new habit, add it to a habit that you're already doing, and try it out for a week. And if you find yourself struggling to complete that new habit, make it smaller, right? Make it as easy for yourself as possible. The goal here is to really just try something new and see how you feel. Really take note, practice that self-awareness, tune into yourself, see how you feel throughout your week, and see how it impacts your resilience in a positive way. So thank you all for participating with me. I hope habit stacking is something that you can use each and every day. And I look forward to seeing how it makes some positive changes in your own life. So at this time, I'm going to pass it back to Ravi.
Thank you, Michelle. Thank you for that. And thank you to Marie and to Cherie for just a really great talk. So important for our firefighters and our emergency medical technicians. As you can see on the screen now, this is our website. I just want to remind everyone that you could reach us by calling 888-653-3367. You can also go to our website at njfireems.com. We have resources, we have more about our program, and we also have we will be posting the webinar from today onto that site. I want to thank everyone for joining us today. We really appreciate you taking the time out of your busy schedule. We're going to invite you to come back to our next webinar, and please bring 1 to 2 of your colleagues to the next webinar. Invite them, make sure that they get here. We have a lot of information. We really want to support our firefighters and our EMTs of New Jersey. And the only way to do that is by spreading the word, spreading the support, spreading the information. So please, for our next webinar, invite 4 or 5 of your colleagues, invite your whole department, your whole squad, tell them to come. We understand not everyone can make it. I'm sure many of you are probably on your devices and you're working now and you're waiting for that call. But please do invite as many as you can. We really want this webinar to grow, and we want this community of resources to also be shared. Thank you again for joining us. Remember to give us a call and be safe. Take care.